I'm Josh, nice to meet you. I will be your personal referral trainer. Okay. I'll be collecting information from you in this little session to help make my exercise programs, to make sure they're safe and they're not affecting you in a bad way.
Okay.
Laura, you can relax, it's all confidential and everything. No one else in the room to me, and all information is just for me to see.
Okay.
So it's my responsibility to make sure all your exercises are safe. I can't give you information about nutrition and things like that because basically I'm not qualified.
Yeah. Sure.
That'll be your GP referring you to a nutritionist, but in this case, obviously, you're referred to me for exercise.
Okay, that's fine.
So yeah, I may possibly bring other professionals into this to help set goals and exercise programs, or refer you if your conditions have gotten worse. Refer you back to your GP.
Yeah.
But altogether, they'll all be professionals, and it's only if it will benefit you. There won't be anyone outside. Okay, so have you got your medical form?
I have indeed.
Yeah. Okay.
Is there?
Check all this. Okay, yeah, looks good to me. Okay, good. So we'll check. So medical surgical history, that medications. Yeah. Okay. You see. Yeah. Barriers. Okay. All right. Okay. So it's a few questions. So what's your medications you're currently taking then?
Currently, I'm taking lipase inhibitors.
Yeah.
Obviously for obesity and diuretics and beta blockers for my hypertension.
Okay.
And that's everything that I'm taking so far.
Okay, great. What about your medical and surgical history? Had any accidents or things like that?
The only thing that I've ever done, apart from obviously my conditions now, is when I was about 28, I tore my Achilles tendon playing football.
Okay.
But other than that, that's pretty much all bad things that's happened.
Fair enough. Okay, that's good. Does it cause you any pain?
Not
or
now, no.
Any...
No.
Okay, that's great. What about your physical activity history then?
Obviously played football.
Yeah. Okay.
And then stopped after the injury. I also did a bit of swimming after to try and get back into exercise, but then I lost interest because it was a bit boring. But
okay. So how long ago were these then? How long ago did you do these?
So I'm 42 now. So.
Oh, okay. So
it's quite a long time ago.
Years,
so yeah.
So yeah. Okay. All right. Yeah. Okay. Great. So, what do you prefer? What are your physical activity preferences? So, what do you like and what do you not like?
I don't mind doing cardiovascular endurance, CV stuff. I don't mind doing it.
Yeah.
Prefer weight training.
Okay.
Resistance and stuff like that.
Any things you really don't like then?
Cross trainer.
Cross trainer.
Can't seem to get it.
Oh.
I just can't seem to get it.
That's fair enough. Okay. Good. So, what's your motivation and barriers to participation? Are you quite motivated to do it?
I am motivated because I want to get back to not as fit as I was obviously when I was younger.
Okay.
But I want to get back to a fit enough stage so that I can sort of play with my kids and stuff. Do activities with them without getting out of breath and stuff. Yeah.
All right. Awesome.
Yeah, so
what about barriers then?
I'd say time maybe.
Yeah,
probably main thing because of work and family.
Kids,
so work and family main thing. So
yep, all right.
Yeah, other than that, not really.
Current fitness level. What would you do now, and how fit would you say you are?
I don't currently do anything, so probably very low.
Yeah, so
obviously.
Are you quite sedentary at the moment? Yeah. I should say that.
Yeah.
Okay. Stage of readiness. So you're quite sedentary and you want to get into it. So would you say that's contemplation? Because that's basically saying that you're not currently doing anything, but you're thinking about doing it in the near future.
Definitely.
Yeah. Okay. Right. Yeah. Okay. Right, personal behaviour goals. Anything you want to improve in yourself and behaviour change? Like, do you go out and do it more by yourself or?
I would say mainly, obviously, decrease body fat and
Okay.
lower blood pressure. And I want to start going to the gym by myself and obviously with friends to
Yeah.
just
Yeah,
have
yeah,
like workout buddies. But that's
yeah.
really,
Yeah, it can help
yeah,
quite
it's just
often.
confidence thing at the end of the day, really. So
Okay, yeah.
yeah.
Right, so would I be able to have your height? You got that with you?
Yeah, I'm 6'3".
Okay, yeah.
Yep.
And your weight?
140 kg.
Yep. And can I have your blood pressure? Do you have that?
Yeah, it is 160 over 100.
Okay. Your resting heart rate?
80 beats per minute.
Okay. Your BMI?
40.
And lastly, your waist circumference?
48 inches.
Okie dokie. Right, good. Okay. So yeah, I can see that obviously got quite a few barriers and everything.
Yeah.
And, you want to change, so
Yeah, definitely.
I'll try my hardest to make sure we try get over those barriers and try help you deal with your conditions, because I mean it must be hard.
Yeah, it is definitely. Yeah.
Obviously, I don't have them myself, so I can't give you my personal views. I don't have them, but
Yeah, that's fair enough.
yeah,
Fair enough.
yeah, I'll try to help you as much as I can, basically. Right, so obviously this emote's going to stay with me. It's going to be all secure, going to keep it in a nice document, and no one else is
Okay.
going to touch it unless
That's
it's
fine.
other
Yeah.
professionals, of course. With your, okay. So, going to set some goals now. So first, I was thinking, how about we do some medical management, managing your medication.
Okay.
So for short term, we could say improve technique on some CV endurance exercises. We could say that in 2 weeks and do that.
Sounds fair. Yeah.
Yeah.
Yeah. Definitely.
Okay. Yeah. Yeah. Right. For medium term goals, so within the next 6 weeks, how about stop taking some medications for hypertension due to blood pressure lowering. Yeah.
Yeah. Sounds
Yeah.
fair. Yeah.
Okay. All right. We'll do that. Okay. If you have any questions about them at all, just ask.
Okay. Yeah, that's fine.
Because it's important we both agree on this. Long term, normalise or decrease overall blood pressure to about 135/80 or lower within the next 2 months.
That'd be great.
Yeah.
Yeah. That'd be
All right.
great.
Okay. All right. Brilliant. All right. So next goal we could do is maybe general health and fitness.
Okay. Yeah. Sounds
Short term. So we say within the next 2 weeks. Do 4 sessions of CV endurance exercise in it. Just get into it. Yeah.
Yeah. Sounds good.
Okay. Okay. Medium term, maybe reduce resting heart rate by 5 beats per minute in the next 6 weeks.
Yeah.
Yep.
Yeah. Sounds good.
Okay. And maybe long term, another heart rate. I think we'll do. Could say about reduce overall to 80 or 70 beats per minute within the next 2 months. Does that sound okay?
Yeah. Sounds great. Yeah.
Yeah. Okay. Lastly, I was thinking maybe psychological. So what we could do for that maybe is complete 2 training sessions within, let's say, next 2 weeks as well.
Yeah, that's fine. Yeah,
short term,
definitely,
yeah. Okay. For medium goal, maybe within like next 6 weeks, try do so because it's psychological, get you to use more stuff like stairs instead of lifts and whatnot, and
Yeah. Okay.
yeah,
That's
yeah.
fine,
Try
yeah.
get you to want to do more active stuff. Yeah, are you okay with that?
Yeah, that's fine.
Okay.
Yeah.
And long term, psychological, could take 10 inches off your waist and look and feel healthier and fitter. Yeah.
Yeah, definitely. Yeah, that'd
Yeah?
be great. Yeah.
Okay. Oh yeah. Give you more confidence.
Yeah,
Yeah.
that'd be great.
Okay. Awesome. Right. Okay. Right. So, like, if with everyday things like going to work and things like that, I mean, it all can come to helping you with exercise and stuff like. Because if you're going to work, you're taking the car. Instead of walking, there's a lot of difference. If you walk every day, it can give us massive gains. Like, so if it's only just down the road, obviously it's a long distance. Then it's going to be hard. But you know, things like that. Maybe walking to the shop if you've got a close shop, or just generally going for a walk just for enjoyment. Things like that would help. Okay, so these goals are SMART goals we've set because they're specific towards you yourself with what you have. Okay, they're measurable because we can see, we can measure how much you've improved or not improved with like with beats per minute. Obviously, check your heart rate.
Yeah, that's fine.
Achievable, then not too hard. We can actually reach the goals for you.
Yeah, that's fine.
Yeah, and realistic because it's not like a really short period of time and a massive goal that you'd have to splat out, and obviously because you've got barriers and things. Okay? And also time, because we've got an end of which it has to be done by.
Yeah, that's fair enough.
Yeah. Okay. Right. So yeah, it'll should reach our objectives and getting you more confident, slimmer, and just in better shape and positive mind about it. Yeah. Okay. Okay. So we could do different environments, like we could go to the gym. We could maybe go on a cycle or things like that. Well, are you happy to do like outdoor stuff? Yeah,
definitely.
Is it alright? Like sometimes in public, do you mind doing exercise public?
Not at all, no.
Yeah, and obviously in gym it will be a bit public sometimes. Yeah,
of course.
Yeah. Okay. Yeah, because like we could do things like road running, like gentle road running, or gentle cycling, just stuff like that. Yeah. Okay. Right. So when I'm contacting you, how do you prefer that? Would you prefer a phone, email?
Yeah, most probably phone. That would be easiest. Yeah.
Yeah, I see. I've got your number down there. Is that the one I'll reach you by?
Yeah, definitely. Yeah.
Yeah. Okay. So obviously I'll keep that. Yeah, I'll write it down. I'll give you mine as well, so you can contact me if there's any issues with anything.
Okay. Yeah, that's fine.
Okay. Right, so when would you like prefer to do it? Do you do it like would you like to do it weekends or evenings?
Mainly in the evenings.
Evenings, yeah.
Mainly in the evenings.
Okay, is that weekend evenings possible as well?
We can do weekdays.
Yeah.
Yeah.
Okay, yeah. That's great. So would we start off maybe Monday? Are you okay to like let's say around 7ish?
Yeah, that's fine.
Yeah. I'll call you up as well to confirm.
And, that's good.
Tell you what we'll be doing and stuff. Yeah.
Definitely.
Okay. We'll do like redo our tests like every month or so, and definitely after every goal has ended, so we can see if we've actually met that goal and how we've progressed. So I need your informed consent. So you know what you're doing. Do you know what we're doing? Do you understand everything? What we're doing exercise wise. How it helps you and things, and you're okay to do this. Yeah. Okay. Brilliant. And obviously, we're going to. We'll get into it and we'll train quite hard, not like too high intensity, but like long endurance. You'll get sweaty, but it'll be good. It'll be worth it in the end. Okay, so if I contact you by that number and we'll arrange it all.
Yeah.
Okay. Yeah.
Thank you very much. Cheers. Thanks, Josh.
Bye.
Bye.
Cool beans.